Hello, everyone. Welcome to another episode of the Root of the Science podcast with your girl, Anne with an E. If you are new here, welcome to the show. It's such a pleasure to have you. If you are returning, thank you so much for coming back. We really, really appreciate your support. Now, in today's episode, I apologize in advance. I'm a little bit nasally, recovering from a cold, but nothing that can stop me from coming to you. So let's get into today's episode. Today, we are hosting Asante Chisa. She's a brilliant young mind from Malawi. Asante is a BSc student in Biomedical Engineering, and she has a passion for innovation and really dedicated to creating practical solutions for healthcare challenges in low-resourced environments. Her current project, the design and fabrication of an IoT drip monitoring system, is really set to revolutionize healthcare and patient care in Malawi by providing real-time monitoring and optimizing healthcare workers' efforts. Join us in this episode as we dive into her inspirational journey of how she actually got here, some of the other really cool projects that she's involved in, and the impact that she hopes to make in the world of biomedical engineering. Also, stay tuned because I'm sure you can already guess the link that Asante has to me. Let's go. Hello, Asante. Welcome to the show.
Thank you, Anne.
It is such a pleasure to have you on with us today. So before we get started, please introduce yourself. Who is Asante? Where are you from? Where are you currently based? And just briefly, what do you do?
Okay, my name is Asante Chisa. I'm a Malawian, and I recently completed my bachelor's degree in biomedical engineering. I'm very passionate about innovation and applying the technical skills that I have, combining it with creativity to come up with solutions to real world challenges. So yeah, that's basically what I can say about myself.
Fantastic. I love that. We're going to get into everything that you do. I think to address the elephant in the room before we get started is the fact that, I'm sure everyone's going to be like, she's Chisa, you're Chisa. So yes, world, we are related. We are related. So to address that out, you are my cousin, and it's such a pleasure to have you on the show and to hear everything about what you do. I'm also going to hear along with the listeners. So let's get into your story and your journey, right? You pursued a bachelor's degree in biomedical engineering. Tell me how, why, what was the story?
All right. So growing up, I wanted to pursue anything related to medicine. I had no interest in engineering. I remember my mother was a nurse, so sometimes she'd take me to the hospital with her. So being in such an environment is what triggered this love for medicine. Now, going through secondary school, we had these female engineers visit our school for this TED talk. And after listening to them, I was quite inspired. I was like, now I want to study engineering. So there was a little bit of that conflict because I still had that interest for medicine. So we had this opportunity to visit to the Malawi University of Science and Technology when I was in secondary school. So that's when I heard about biomedical engineering. So biomedical engineering is basically a blend of medicine and engineering. So I was like, oh, so now I can actually study both. I can study medicine and I can study engineering. So yeah, my love for technology combined with the desire to bring about an impact in healthcare is what led me to pursue this degree in biomedical engineering.
Oh, lovely. What a wonderful story. And the fact that you got to blend your two loves. And I think it goes to the point of how important it is to have visible role models, starting from your mother, and then of course to the people who came to your school and were like, listen, this is an idea. Because I will be honest with you, I did not even know this career exists. I mean, when I think of medicine, I think of
Yeah.
medicine or I think of engineering, and I think that's the case with many people. We think of them in these two different categories. So the fact that
Yeah.
you were able to be like, wait a minute, I can like blend the two things. That's pretty fantastic. So for somebody who is listening to you and is like, okay, Asante, you said I can do these two things that I love. How did you go about it? Talk us through your journey, maybe like applying and, some of the actual practical steps for somebody you can use in the context of Malawi, how you went about it.
Okay, so the first thing I should say, you have to be really good in your science subjects. We're looking at mathematics, looking at biology. You have to have really good grades. So for the grading system in Malawi, we're also looking at the points that you got for your MSCE, or maybe if you were doing your IGSCE. So you have to have not more than 15 points. That means your grades have to be really good. And so the process is quite simple. You just have to make sure that your grades are compatible with this field. And I think with the current system that the MANE board has actually organized right now, it's actually possible for you to know whether your grades are compatible with this particular field. So if they're not compatible, the system is actually able to filter out anything that, yeah, doesn't align with what you're applying for. So yeah, that's basically the advice that I would give someone, to say you have to be really good in your science subjects.
Okay, lovely. So, Asante, we've spoken about your journey. We've spoken about you giving us some of these practical steps. So now we're gonna like skip ahead to the very end. So,
Yeah.
in your final year, you had a specific project, right, that you had to work on. Can you please tell us about this project and the work that you did and how it actually started, the inception from the beginning?
All right. So the inspiration for coming up with this system was drawn from the challenges that are encountered in as far as IV therapy is concerned. So now we are also looking at the imbalance in the ratio of healthcare professionals to patients. We have a few healthcare professionals in our hospitals. And so having a few healthcare professionals makes the IV monitoring process very very challenging. So we thought, why not develop a system that does the monitoring for you? And it actually monitors the drips accurately. Because, when you're monitoring the drips manually, there is a risk of human error.
Yeah.
So developing this system aims to automate the monitoring process. So you should understand there are three parts to the system. You have a sensor module that is connected to the IV line. And this sensor module is responsible for collecting data. When I talk about data, we're looking at important parameters during IV therapy, such as the infusion rate, as well as the volume that is being infused to the patient.
Mm-hmm.
And then secondly, we have a monitoring device. So this is another separate entity on its own. And this monitoring device is responsible for displaying the data that we collected from the sensor module. So the infusion rate, the session time, as well as the volume that is being infused is displayed on this monitoring device. Mm-hmm. And the other thing is that this is where you input important aspects such as the weight of the patient as well as their age. Now, on the far end, we have a mobile application. So Internet of Things comes in such that we are able to create this network of multiple devices connected to separate patients, but we're able to collect data from each and every one of these devices, and we're able to display it on a single mobile application.
Okay.
So not only are you able to monitor your patients in real time, but you're also able to do it remotely, and you'll be able to monitor multiple patients at the same time, say up to 100 patients. Wow. So yeah, we also have a notification system on the monitoring device such that whenever there is an error or any deviation, there'll be an alarm on the monitoring device. And you also be able to receive notifications on your mobile application. So by employing such a system, we're reducing the workload on our healthcare professionals, and we're ensuring that the IV monitoring process is quite efficient and effective. Yeah.
Wow, this is absolutely amazing. Wonderful, wonderful, a very innovative tool. You mentioned that you said we, so how many people were involved in, conceptualizing, building this whole entire model?
Also, so this is a collective effort of three people: myself, Bryson, and William.
Okay.
So yeah, they're actually my classmates.
No, this is so innovative. Now, this is absolutely brilliant. I think not only it can be applied in so many countries, because that's always the case, that high patient numbers and as well as low medical professionals. So I think this is very, very innovative. But I mean, there's
Yeah.
always going to be a but, right?
Yeah.
Seems to be a very complicated tool. It needs, it needs electricity. It needs, I'm assuming it needs a mobile phone. So talk to us. What are some of the challenges that you faced working on this project, especially in a low resource country like Malawi?
So yeah, the challenges were actually theirs. And one notable challenge was, yeah, to do with resources. We didn't have any funds, especially during the early phase of the project. And we had to be resourceful. I remember we actually borrowed some components from our school's design studio because we couldn't afford to procure quality components for ourselves.
Yeah.
And there was another incident whereby one of the computers that we were using to actually develop the mobile application failed because it couldn't handle the capacity required for the software that we were using to develop the application. So yeah,
Sure.
it was quite challenging.
Yeah.
And another thing I'd say was that we lacked, I should say, a well-invested mentorship.
Mm-hmm.
Of course, we had our supervisors, we had our lecturers, but they were not entirely committed to the project. So the early phase of the project required a lot of self-learning. We
Yeah.
had to learn a lot of things on ourselves and a lot of experimentation. So this actually prolonged the prototyping phase of our project. But regardless of this, we were very resourceful, we were resilient, and we managed to pull through. Yeah.
Mm.
So, yeah.
You said that it took a while to do this, and you mentioned some of these challenges. So I'm interested, and I'm sure even the viewers, where are you at this stage with this innovation?
So we have only managed to produce a low fidelity prototype.
Uh-huh.
But fortunately enough, we recently won a grant from
Mm-hmm.
our school, and they're willing to fund us so that we will be able to produce a high fidelity prototype. So yeah, we are still on the prototyping phase of this project.
Okay. You
But
mentioned.
yeah,
Sorry, go
the
ahead.
prototype is functional.
Okay.
We have
It's
tested it.
so when you say high fertility, it meaning it's a high functioning prototype.
Yeah,
Oh,
yeah.
okay. Great. I wanted us to all be on the same page. So now I'm excited. I'm so excited about this. And I'm sure hopefully somebody is as excited about this as we're listening. And I'm just thinking about how this IoT drip, monitoring system can impact the healthcare in Malawi and obviously in other regions as well, in Africa, I mean, even the global south. So, what are your thoughts
Yeah.
on that?
Yeah, employing such a system will really be impactful in our healthcare settings because, like I mentioned earlier, we are reducing the workload on our healthcare professionals such that they'll be able to monitor multiple patients at the same time. And we are also going to reduce the risks associated with IV therapy. So we are looking at incidences where you have, say, maybe over infusion, you have under infusion, or maybe you have a patient that has finished their dose of the IV therapy, but the healthcare professional doesn't know that the session has completed and maybe they need to start another session. So yeah, having such a system that is able to notify you whenever there are errors is going to actually bring a certain impact and improve overall healthcare delivery in our hospitals.
Yeah, this is so exciting. Keep working on it. You guys are on the precipice of really something great. And I hope you get the support that's
Yeah.
needed because, like you said, it requires money, funding, because most of these things do not just fall off from the sky.
Yeah.
And now I'm also even thinking we're going to now touch on the human capital, which is more the support from people. So you mentioned you worked with Mr. Bryson Juluse and Mr. William Batala on this project. So how has that collaboration with your two classmates, right,
Yeah.
been, and what role do they actually play? And what
So
is your role as well?
so yeah, this collaboration has been quite rewarding. We actually make quite a good team. So myself and William have been working on the hardware aspect of this whole system. So we were responsible for the electronic parts, making sure that all the technical aspects of the system are in place. And Bryson, on the other hand, he's the software guru. He has been responsible for developing the mobile application. So yeah, he handles the data processing as well as the communication aspects of the system. So yeah, this collaboration has been a blend of complementary skills that has ensured us to produce a very effective system.
Okay, so the way that I understand it, you and William were the engineers, the actual, like,
Ye-
the engineering
Yeah,
aspect, and then you
yeah.
had the software um coding, etc. That was Bryson.
Yeah,
Okay, it's
yeah.
beautiful that you found a beautiful blend of the four of you. And again, I'm gonna reiterate that I really wish you all of the best. This is such an innovative idea, and I really, really hope that somebody listening can reach out so that you guys can get the support. So, Asante, you are a busy bee, right? Apart from this wonderful project that you're working on, you also had an experience at the African Drone and Data Academy. Um, is Can you tell us about that?
Okay, so it was a 6 week online course.
Hmm.
I recently completed it. It was quite exciting, quite hectic, a lot of work, a lot of learning, a lot of assignments. But yeah, in the end, I've acquired a lot of knowledge on how to process data and how drones can be applied in various fields, including healthcare. So I'll give an example of how you can employ drones in healthcare. For example, in incidences where you have to deliver medical supplies in hard to reach areas. So, yeah. And another example would be how you can equip drones with thermal sensors to pinpoint areas with disease outbreaks.
Mm.
So yeah, that blend of drone technology and medical engineering has actually great potential in bringing an impact in healthcare delivery.
Do you think some of the things that you learned, you can take it back into your project and maybe also in future?
Yeah, I do believe so. Yeah, yeah. Drones have really great potential, and I'm looking forward to actually employing the knowledge that I've acquired in my future projects.
Hmm. Amazing. Okay. Another one of your very interesting activities that you've been part of is you participated in the Air Fox Entrepreneurship and Innovation Scheme in 2024, which is this year.
Yeah.
So talk to me about that. What is that? Why did you think this is something that I should do?
Okay, so the African Oxford entrepreneurship scheme is an initiative that has been put in place to help young innovators like myself to actually bring our ideas into a reality. So this is where you are taught on various aspects such as market trends. You talk of how to validate your ideas, how to actually practically implement your ideas, and how to develop a viable business model. So, yeah, it's basically about commercializing your idea, bringing it to the market. So, this opportunity will really help us on how to actually bring this idea. So, we'll continue working on our project, the
Yeah.
IoT drip monitoring system. So, this is just a platform to help give us mentorship on how we can bring this idea to the market and how we can in the end actually implement it so that we see it in the hospitals. So yeah, this is an opportunity for us to have a well invested mentorship and networking opportunities. And I believe that the knowledge that we will acquire through this scheme will help us navigate any challenges that we might encounter along the way with a more strategic mindset. Yeah.
Yeah, of course. I think this is really brilliant. Apart from just the wonderful skills that you're going to learn that you can implement into your project, I think another thing is also the types of people who you're going to meet. The networking is going to be very valuable. And I'm not only meaning, of course, the big shots, but even just your peers who are also part of the projects. I think it'll be interesting maybe to just, the peer learning aspect. So congratulations on that. I think that's pretty fantastic that you are not just sitting with your idea. And maybe this is also the idea that needs to come across that, us as young innovators and young scientists in our field, we have really amazing ideas. But when you feel like, okay, maybe in Malawi, in my institution, I'm stuck here, where can I go to get additional support? And I love that you're very resourceful in that aspect, you and your team, because this idea needs so much more. And I'm sure it's gonna, the more you do these things, it's gonna open up another door and another door and another door. And eventually we are gonna see this drip in our hospitals and we're gonna be like, Asante, come back to the show. Let's talk about it when you become this really cool. And now we're gonna have your team that you're working with. I think all three of you to really talk about the journey. So it starts right here and right now. You've also been involved in the girls' STEAM camp, so STEAM being science, technology, engineering, arts, and mathematics. Can you tell us why about this an initiative, and also why again? This was something like you were like, okay, I have a very busy schedule already, because I'm sure everybody's like, girl, again. So tell us about this and why you're like, okay, you know what? This is something that I need to do.
Okay, so the Girls STEAM Camp is an initiative that is organized by MAST. So it's basically put in place to empower and inspire young girls to pursue disciplines that are related to this field, stock of science, technology, engineering, arts, and mathematics. So yeah, it's a boot camp that runs for about 2 weeks. And the girls are exposed to practical sessions, workshops, as well as mentorship on how they can go about pursuing programs related to these fields. So in my role as a facilitator during the STEAM camp, I was responsible for organizing and leading sessions on various STEAM-related topics. And one notable example was a project whereby we were using recycled plastics to come up with artistic pieces. So in that way, conserving our environment. And there was another session whereby we were teaching the girls on how they can leverage 3D printing to come up with various materials that can be utilized in a various range of industries.
Yeah.
So yeah, This was quite a rewarding experience, and it was actually nice seeing the girls' enthusiasm and growth and that love for the science subjects mature along the way. So, yeah, this is a very good initiative and quite inspiring.
That's so fantastic. And I love that you went there as a facilitator,
Yeah.
to impart your own knowledge and to your love into other young girls. As we are slowly starting to wrap up, we've spoken about all your wonderful professional achievements and some of these academic achievements. Um, but apart from that, you're more than just a biomedical scientist and a future innovator, entrepreneur, etc. You actually have a passion for interior design and as well as, do-it-yourself projects, which kind of makes sense because as an engineer, you need to have that aspect. So can you tell us how these interests really like blend in and mesh into your professional pursuits and your personal love in engineering and biomedical sciences?
It's funny because I've never actually thought of it that way until you asked. So yeah, now that I think about it, the things that I learned through interior design and DIY projects have really a significant impact on how I approach engineering and innovation. So I'll give an example. In interior design, not only are you looking at the aesthetics of a given space, but you also want to ensure its functionality as well as a good user experience. So these are the very things that you have to apply when you are developing technological systems as well as medical devices. Now, when we look at DIY involves a lot of creativity and being very resourceful, using what you have at the moment. And those are the very same things that you use when you're developing, say, medical devices or systems. So yeah, the creativity as well as the attention to detail that comes along with engaging myself in such things has been quite an essential tool in my approach to any problems, as well as coming up with innovative solutions when you're developing systems.
That's so amazing, Asante, and it got me thinking to what you said in the beginning, right? Where you said you had, because it kind of brings back to the beginning where you had a love for medicine and you had a love for engineering and you were able
Yeah.
to blend these two things. And now similarly in what you just explained right now. So it seems like I don't know whether you do it consciously or unconsciously. You've got a
Yeah.
wonderful way of blending various different aspects and kind of merging them into creating something really amazing. I think when you think of it like that, I think that's actually really cool. So, somebody's listening to your story. I mean, it's been so fascinating hearing about what you do and your journey. What advice would you give them? Somebody who's a fellow innovator or, researcher, facing some of similar challenges or just generally inspired by your own personal story. What would you say to them?
Okay, so the first thing I'll say is creativity is a great tool. You have to be creative, think outside the box, be unique, be yourself, and yeah, embrace the challenges. The challenges will always be there, but all you can do is use them as an opportunity to be innovative. Another thing I would say is build strong networks, build strong relationships, especially with people who have gone ahead of you. You have to be humble enough to learn from them. And lastly, I would say be resilient. The greatest breakthroughs come from a lot of perseverance as well as a lot of continuous learning. So, yeah, keep on learning, keep on trying hard, and it all gets better in the end.
Wonderful, wonderful. Be resilient, keep on learning. And I love the fact about the creativity. Asante, thank you so much for coming onto the show, for telling us about what you do, your work. We wish you all of the best. Again, like I said, we're going to have you three back. Maybe it won't be three, maybe it'll be a team of five by the end
Yeah.
all of this is done. But I
Yeah.
really wish you guys all of the best. Keep pursuing greatness and, that whole thing of you wanting to have an impact in the healthcare system. I think you're well on your way. To everybody
Yeah.
else who's listened to the show, thank you so much for taking the time to listen to me. Pardon my little sickness, but we made it through. It's always such a pleasure. Thank you for tuning in, and let's see you next time with your girl and with an E. Goodbye.